Hi, welcome to our channel. I'm just now coming out of a webinar that was organized by the Indian Society of Lifestyle Medicine, and it's a part of the third annual international conference of Indian Society of Lifestyle Medicine 2022. And the webinar was on implementation of lifestyle medicine at population level. It was about 1 hour, 15 minutes, and I was a panelist there. And in this video, I shall be summarizing the discussions that happened in this panel. Now, this panel was moderated by Dr. Rabbani Tariq, who is a very active member of ISLM. We had Dr. Sunila Garg, who is the immediate past president of Indian Association of Preventive Social Medicine. We had Dr. Jayesh Lele, who is the Secretary General of Indian Medical Association. And we also had Dr. Sheila Nambiar and Dr. Anjali Nakra from ISLM. So it was a very interesting discussion. And there are different avenues of lifestyle medicine that was discussed in this panel. Now, when we talk about lifestyle medicine, what exactly is lifestyle medicine? We all know that the burden of NCDs is going up exponentially. Even if we talk of double burden of disease, NCDs are now taking up a big proportion. And it's a thing of concern. How do we do something for preventing and managing NCDs? Because most of these conditions are treatable, controllable, but not exactly curable. So a lot of effort has to go into prevention and promotion, and at the same time, adherence and modifying lifestyle. So irrespective of the NCD, everyone is recommended a lifestyle modification. But how do we prescribe lifestyle as a therapy to these people? And that's the definition of lifestyle medicine, where you are prescribing diet patterns, lifestyle patterns, exercise patterns, customized to the individual, and at times to the group. And that's the context. That was the context of this webinar, where the team deliberated on what strategies may work going forward. Now, why lifestyle medicine? Lifestyle interventions can be taken up into primary care, and there is some evidence around it. They make the entire approach very patient centric. That means you take the patient's considerations into your prescription, and that's very empowering that way. And also it makes sustainable behavior change, and the entire approach becomes very sustainable that way. If it becomes sustainable, then the costs would come crashing, and then the burden on the health system will also be taken care of. Now, with that said, the questions that came up is like the concerns that were raised is like it is a huge variegated population in India and in LMICs, and even if we have in India, in the Indian context, we have the health and wellness centers coming up, the foot soldiers, the network of frontline workers is there, and there is some very interesting movement happening in the highest political spheres, where there's a lot of emphasis on yoga and Fit India movement. And at the same time, the medical fraternity has also been tasked with like adopting health and wellness centers and families into their curriculum, and taking care of those health and wellness centers and family level families. That means that there's an interesting change happening in the ecosystem here, where lifestyle medicine can be very effectively positioned in the medical curriculum, undergraduate curriculum, and postgraduate curriculum, and at the same time can be taken to the communities in the rural areas and in the upclass urban areas, as well as in the slums. But each requires a very customized approach. Coming out of the COVID-19 pandemic, there is, of course, some emphasis on, like, some awareness in the population at large about lifestyle modifications and the need to take care of one's health and multimorbidities, comorbidities. But is it consistent? No. Is there a very strong demand for lifestyle interventions from the population? Not perceivably yet. There is much ignorance about what exactly is lifestyle medicine among the population at large. There is not a very massive demand yet from the communities. In the medical, when I say medical, it's not just the doctors, like the paramedics also, and everyone across the hierarchy of health system. We do not have enough human resource which has been trained and certified on lifestyle medicine interventions, and across specialities as well. So is it the realm of just the community medicine or preventive social medicine people? No. Is it something that has to cut across specialities? Yes, because it takes everyone together, and everyone must be able to speak at a consistent pitch. Now, that means there has to be some standardization and engagement across stakeholder constituencies. So different specialities, different providers, communities, program managers, policymakers, everyone has to come together. If we look at contextualizing lifestyle interventions at the grassroots, that means it has to be decentralized right to the level of the districts, where lifestyle medicine enthusiasts or patrons or those people who have been certified, trained, must engage with the program managers to design interventions that may work at the population level. If it comes to city planning, then RWAs have to be sensitized, community leaders have to be sensitized. If it is about undergrads and medicos, then it's not just about giving them theoretical orientation, but also making them like convincing them to practice it themselves. So that means walk the talk. So undergrads and healthcare providers have to be role models here. So if they practice it themselves, then the theory starts translating into day-to-day habits, and that's when they can convince their patients as well. There was a lot of call for collaboration. Given the numbers of lifestyle medicine trainees, enthusiasts, patrons are really low at the moment. So that means we need to collaborate with different stakeholders and do a skill transfer. Maybe a TOT, a training of trainers, may help at this moment. But if we transfer the skill right to the grassroots, then it becomes sustainable. There was a call for improving not just the diet but also physical activity and overall lifestyle among doctors, and many nuances were discussed. I'll provide a link to the recorded video in the description if it is available. Maybe it will take some time for me to update, but then we will do that. There was an effort. There was a call that it's time to move from know-how to show-how. So lifestyle medicine can take that one up. Some deliberation was made around urban environmental interventions, and the concept of blue zones were discussed. You can Google up what is blue zone, so what I could understand is blue zones are like there are 6 pillars of lifestyle medicine, and blue zones are certain areas that have been able to implement all 6 pillars. Much of the lifestyle medicine related interventions are a part of our traditional practices, which are being gradually lost due to modernization. So how do we get those practices back in life? Those elements were discussed. And to end with, it was also mentioned that lifestyle medicine also shows different trajectories. So the West is apparently a bit ahead of India at the moment. India needs to catch up. This is an interesting area of, I would say at the moment, preventive medicine. But then, yeah, lifestyle medicine in itself is coming up in a big way as a specialty. But if you are into public health or preventive medicine, or social preventive medicine, community medicine, then this is an area where you could develop your interest and start learning. There's a certification program also. You can Google up, and if you're interested to take up those certification programs, it will help in doing some kind of practice of lifestyle medicine. So that was all. I think this was useful. We'll try to keep you updated by providing the link to the recording. Thank you for your patient audience. Thank you so much.